Good morning, everyone. Welcome to our Facebook Live session. We love Nogales. Thanks to our viewers for supporting our efforts in public medical education. My name is Eladio Pereira. I'm the Chief Medical Officer at the Mariposa Community Health Center. And with me I have two colleagues who I value a lot. I talk to them all the time about various infectious disorders, and I'm going to let them introduce themselves with me. Fernando?
Hello, my name is Fernando Silvas. I am the Public Health Emergency Preparedness Manager for Santa Cruz County.
It's always a pleasure. Phil Williams, Associate Medical Director at Mariposa and also pediatrician.
Thank you, Fernando. Thank you, Dr. Williams. And I'm told we're going live, which means if we make a mistake, please forgive us. And that we'll do our best to do all the right things. And so today's topic is monkeypox. It's been in the news lately because of rising number of cases. And just before we began the transmission, we're talking about the changes. It looks like the virus is called monkeypox, and the disease is called MPox. And it's transmitted humans to humans. We're here today to speak about it and educate our community. We're going to divide our talk into various aspects. One would be the epidemiology, what's happened in our state, other information that Fernando thinks is useful. Dr. Williams will speak about the transmissibility, how it spread to others, and I'll finish with the vaccine. Ahora vamos a hacerlo en español. Bienvenidos al programa de Facebook de Mariposa Health Center. Mi nombre es Eladio Pereira y soy el director médico de Mariposa. Conmigo tengo dos colegas que trabajo con ellos frecuentemente. Fernando Silvas.
Fernando Silvas.
Epidemiology en el Departamento de Salud.
Departamento de Salud.
Y el Dr. Williams, director médico asociado de Mariposa. Vamos a hablar español e inglés para aquellas personas que se sienten un poquito más cómodas con el español. So, what's happening at the state? Monkeypox has been in the news, an outbreak in the Republic of Congo. What's happening at the state level?
Correct. Well, the state is definitely keeping everyone informed, different jurisdictions. Right now, as of a couple days ago, I can talk about a couple other counties. Maricopa County had 39 cases in the last year. Pima County had 4 cases in the last year. I can tell you that Santa Cruz County at this time has seen 0. And to my knowledge, our friends across the border in Sonora have seen 0 also. So, but people are dialoguing. We're being very, we are surveilling the situation, and we are making sure we are maintaining awareness. As far as besides the regular communication, counties amongst ourselves as well are taking steps to prepare for the possibility of a few cases here, or people at least inquiring or needing assistance to prevent the spread of monkeypox, and that's by acquiring a vaccine, conducting surveillance, and staying up to date on the latest topics. As far as the county health, how we would approach a case of monkeypox here in the county would be to identify, we would conduct an interview after a case was identified. We'd try to establish close contacts, figure out who the person has been around, family members, friends, intimate contacts, so that we can help mitigate and stop the spread beyond that individual. We would provide education. We would offer vaccine if it's applicable, either through health partners like yourselves or through us or through our resources. We would definitely ask quite a few questions. Sometimes they might seem intrusive, but it is for the benefit of the community. We want to try to prevent the spread, and we don't believe that a localized infection would spread. I think that county and state agencies, along with our health partners, can definitely contain the spread of monkeypox. We have a strong medical infrastructure, so I think that that we can hold it at bay. But it is important for when we do conduct interviews that the individual who's affected by the virus, be very honest with us so that we can identify these individuals who might need prophylactic treatment or vaccinations, and just support quickly and effectively to help stop the spread and prevent any further cases.
Thank you for that. And I think you underscore the importance of public officials like you working with other healthcare entities to educate the community, to identify cases, to do contact tracing. But it only works when people are honest. They give us the right information so we can contain it. We know that when we talk about the spread, we know this particular illness is spread mostly skin to skin, but there's some concern about the respiratory route and the airborne. So essentially, we depend on each other to be able to contain that. And our ability to contain depends on identifying cases early, looking at who's been in contact with who, and administer the vaccine to those who are being exposed, because the vaccine still works even after exposure, or in situations where the individual is considered high risk, which means that we're going to move to spread. Dr. Wen, can you talk about how it's transmitted to others, and that determines the prevention strategies that we create?
Of course. So transmission can occur a few different ways. One is animal to human. So for instance, in places like the Democratic Republic of Congo, where people hunt, animals that are infected, that's possible, either through a bite or a scratch, also through eating undercooked meat. You may have remembered in 2003, there was an outbreak here with prairie dogs that were infected. And we think the transmission is not actually primarily through monkeys, but likely through small rodents. Another way of transmission is from human to human. So as you mentioned, that's typically through direct contact, through skin. So sexual contact is one way, but it's not only sexual contact. It's also, for instance, family members. If people living in the household also have that direct contact to skin, it can also spread. Vertical transmission is possible. So what we mean by that is spread from mom to baby. So for instance, as baby passes through the vaginal canal, it's also possible. It's very rare, but fomite transmission is also possible. So fomites are basically inanimate objects. For example, a blanket that's heavily soiled with secretions. It's also very rare, but possible. And then, you mentioned respiratory secretions. It's an ongoing research to identify exactly how it is spread via respiratory route, but that also is possible.
So, Fernando mencionó el número de casos en el condado de Santa Cruz es 0. En este caso no se ha identificado ningún caso.
El condado de Santa Cruz es 0.
Es 0. Pero han habido casos en el condado de Pima y Maricopa, y esa es la razón que estamos aquí. Es para tratar de identificar el primer caso si sucede y evitar transmisión a otras. Y hablamos de la importancia de una colaboración buena con el Departamento de Salud y otras entidades de salud como Mariposa, el hospital, para poder identificar los casos. Y el doctor Williams habló de la transmisión de piel a piel, contacto íntimo. Ha habido casos a través de la ruta respiratoria, de objetos, pero en general la ruta más efectiva es de piel a piel y el contacto íntimo, y vamos a hablar de eso un ratito. So I'm going to touch a little bit on the symptoms. Sometimes the symptoms are very non-specific. Usually systemic symptoms, fever, chills, muscle aches, exhaustion. But I think what we're interested is in the rash. And so typically it could take 3 to 17, 21 days for the symptoms to appear. Most of the time the rash appears within 4 or 5 days, but it could be up to 21 days. And even though the systemic symptoms are there, they can be confused with really anything. So the idea is the history, having had a situation that places the individual at risk, followed by systemic symptoms, followed by a rash. And I think for us, the rash is key. It goes through a number of stages, but for us, the classic is the blister, is that fluid-filled structure that appear mostly in the face and the trunk. And it could be 1, 2, 3, 4, 5, but that should be the clue. We were talking earlier that it can be confused with other diseases, and that's true. A lot of the symptoms are systemic, and then suddenly, by the way, I have this rash. And that should lead the doctor to ask more questions. So those are the main things we look for. The individual is contagious, if you will, until all lesions are healed. And that could take a while to get there. If we identify the case early, we can give the vaccine. There's no known available effective treatment in terms of an antiviral, but we have a vaccine that can be given for those individuals who are high risk, and I'm going to turn it over to Dr. Williams in just a moment for that. But also individuals being exposed. If you can get the vaccine within 2, 3, 4 days of exposure, is more effective, but it can be given days after the exposure is done. Mm-hmm. And so the high-risk individual, Dr. Williams, can you talk a little bit about those individuals might be?
Of course. So especially, men who have sex with men, or MSM, is a definite high-risk group. Also, people with multiple sexual partners, individuals that have had a recent sexually transmitted infection or multiple STIs is also a very high-risk group. The CDC, we'll talk about the vaccine next, but the CDC does have kind of set criteria in terms of those who are considered high risk.
And Mariposa has the vaccine. It's a live vaccine, and if you have any questions, we can certainly answer that. We bought about 10 doses, so that would be for about 5 patients. It is recommended 1 dose, and then 4 weeks later, the second dose, and it is estimated that full protection will be achieved 2 weeks after the second dose. So we'll have doses for 5 individuals. Certainly, if someone comes in, asking for the monkeypox vaccine, we listen carefully because that individual likely is at risk. He or she knows what's happening, and so we want to make sure that they get the vaccine for additional protection. Before we began, Fernando and I were talking about the different clades and that's important because depending on it, the mortality could be 1 in 10. Right. And so you want to expand on that, Fernando?
Sure. So there's 2 clades. Clade 1 is primarily located in Central Africa, right around the Democratic Republic of Congo. Clade 2 is more Western Africa. And clade 2 is the one that we see in different countries. Not as virulent as clade 1, and is less mortality and seems to be able to jump a little bit easier. But clade 1b is definitely highly more virulent and more risk of secondary infections or complications that could lead to death.
And clade 2 is the one that's responsible for more the global outbreak.
Exactly. Clade 2 would be what you would see in the United States and other countries is what you're seeing with clade 2. Clade 1, to my understanding, is still only in continent of Africa.
Right. Excellent. So the idea is prevention. hopefully with this talk, there will be increased awareness of being extra careful. We always talk about safe sex, preventing skin-to-skin contact with individuals you don't know, particularly in terms of intimacy. And of course, the vaccine is available if there's a situation that warrants a vaccine. Any other thoughts before I move to something else? Anything else you'd like to talk about?
I think just one more thing to highlight would be not to ignore symptoms. If you feel like you were at risk of being exposed to someone with MPox, don't ignore the symptoms. The flu-like symptoms, the rash that might start off just looking like a pimple. Definitely talk to your provider. Go to your doctor and get evaluated.
A Mariposa is able to do the testing. We had the supplies needed. I was talking earlier about it's a PCR test, polymerase chain reaction. We'll do the test of the blister, and the intact blister. We don't unroof it. We take a sample of the intact blister. We send it out, and that will be tested. So we're able to do that test. Anything else, Dr. Williams?
No, also just want to say that, it's a little separate, but for those who are engaging in high-risk sexual activities, for instance, sex with commercial sex workers, there are other options like PrEP. So it's basically a preventive medicine to prevent HIV, which we also have and prescribe at Mariposa.
I'm glad you mentioned that. So PrEP is available. We also have PEP too, not just against HIV, but also about other sexually transmitted infections. Now it's recommended that individuals who have sex without condoms, that a single dose doxycycline is effective. The sooner the better, usually within 72, and we can offer that at Mariposa as well. So not just about HIV, but about gonorrhea, about chlamydia, and things of that nature. Single dose doxy does work. So we have PrEP and we have PEP, PEP. So, vamos a resumir un poquito lo que hemos hablado. Hemos cubierto el tema de Monkeypox. Lo importante de las cositas que hablamos es reportar síntomas que sean importantes, fiebre, dolor muscular, dolor de cabeza y el rash, que es muy típico. Son unas lesiones pequeñitas que tienen líquido en el tronco del cuerpo, en la cara, particularmente si ha habido una situación de alto riesgo en términos de contacto íntimo con otros individuos, más bien hombres que tienen relaciones con hombres. Tenemos la habilidad de hacer el diagnóstico tomando una muestra de esas lesiones. La idea es hacer el diagnóstico a tiempo para colaborar con el Departamento de Salud, para hacer la investigación apropiada y evitar la transmisión a otras personas. La vacuna está disponible en Mariposa, y aquellas personas que tienen preguntas nos pueden llamar y podemos colaborar o consultar en términos de ofrecerles la vacuna a los individuos. Y finalmente el Dr. Williams cubrió el tópico de prevención contra el virus de VIH o HIV. Podemos hacerlo antes de la posible infección. Hay ciertas medicinas, hay una medicina que contiene 2 medicamentos que se toman diariamente en ciertas condiciones, pero también tenemos intervenciones efectivas que pueden administrar después que haya algún tipo de situación donde el virus de HIV o VIH se pueda contactar. Y yo creo que hemos terminado. ¿Algún otro comentario? Anything else, Dr. Williams?
No, just like Fernando said, we are here and available to answer any questions.
Exactly.
Right. I hope this is useful. We spoke today about monkeypox or MPox, about the transmissibility, about the symptoms, about the testing, about the importance of vaccine. I hope this has been useful. Muchas gracias a todos. I will see you the next time. Thank you very much. Bye-bye.